it's Jenny D, and we're here with Dr. Kohli. Of course, you can see her on 9 News. You can also go and check her out and make an appointment at Cherry Creek Heart. But today we're going to talk about the flu cases surging in Colorado. You and I, off camera, were talking about how we got hit pretty bad over the holiday season, and I feel like there's a lot of people right now that are doing that. And I know most states are up. How is Colorado in that ranking?
We are red hot. In fact, we're one of the hottest states in the country right now in terms of our flu activity. And so, it's kind of surprising this early in the season. It's early-ish in the season.
Because isn't it usually February?
Yeah, so we can sometimes see a spike in late December and then sometimes in February. But here, what we saw this year is really cases started surging in November. So we're really dealing with this kind of super flu variant that's going about right now. And because the activity is so hot right now in Colorado, it's really time for us to start being a lot more mindful about the flu.
And why are they calling it a super flu?
It is a super flu. So it's one of these variants that has evolved. So it's mutated. It has over 7 mutations that have made it much more likely to spread. So in a normal year, let's say 100 Coloradans got the flu, they would give it to 120 other Coloradans. This year, those 100 are going to give it to 140. So it's spreading more efficiently, and it makes you sicker because of those mutations that it's accumulated. So this is called the subclade variant. It's a new variant of the flu. And of course, when it comes to the flu, we're always sort of one step behind, unfortunately, because our vaccines that we designed were against last year's variant.
Okay.
And this has evolved significantly. So even though we don't think the vaccine this year is going to offer that much protection against getting the flu altogether, but I will say if you get the flu, like I think I did, it's probably going to be a milder case. So I would still encourage people to get vaccinated if they haven't gotten vaccinated.
Yeah, because we got hit hard. And that was, when you get kids, you get sick anyway. Yeah. They just bring home all those little germies, which is so sweet of them.
And the flu spreads really efficiently, Jenny. Like it's highly, like I said, not just more contagious variant, but it can spread through respiratory droplets. So if you're living in a house with somebody who has the flu, it's really difficult for you not to get it. For most of my patients, I would say it's probably a good idea if you start to feel sick within the first couple of days to swab, because if you test positive for flu, you can talk to your doctor about Tamiflu, and that's more likely to shorten the duration of your illness and also makes you less infectious to others. And some of our high-risk groups, so I have a couple of patients who live with their elderly parents or such, if they test positive for the flu, we actually start to treat their parents preventively with the Tamiflu so that they don't end up then getting the flu.
And who is, I would say, getting hit the hardest right now?
So this is what's really weird about this year. Normally, we say the older people get hit the hardest. Now we're seeing the younger, healthier people, and of course our kids, get hit the hardest with this particular variant. And I think there's a couple of reasons for that. When it comes to our really young kids, their immune systems are really naive. So they just haven't seen as many germs, and so their immune system just overreacts sometimes. That's why we're seeing a lot of pediatric hospitalizations from the flu. But when it comes to those young, healthy adults, I think we have seen such a low rate of flu vaccinations this year that I think that that's really set them up to get hit a lot harder than they had been hit in the past, because the variant is a super flu, essentially.
And so, so we got the flu, so you get the vaccine. What if, say we got the flu, we got it in my house, is it still okay to go and get the flu vaccine? Or is this something where when I had the flu, that actually helps me to build up an immune system?
So let's say you were not vaccinated, you got the flu, you've got natural immunity, but you have to document that you got the flu. And that's another reason to really do those over-the-counter tests. And they have these now available at any pharmacy or drugstore. They check for both COVID and flu. And if you want, you can sometimes throw in the RSV as well. Sometimes they have the strep ones too. But at least COVID and flu. If you have muscle aches and pains, fatigue, sore throat, cough, fever, go and get that test, because then you'll know whether you need to then go and get the flu vaccine or not. Because from my illness, for example, I tested negative for flu. Now, thankfully, I had been vaccinated. But had I not been vaccinated, I would have gone and gotten the vaccine, because it's not too late to protect yourself. And in fact, right after you get over an illness, your immune system's actually a little bit suppressed because it's tired. It's been fighting an infection for a week or so. And so that's kind of your highest risk period to get a secondary infection. I'm seeing a couple of patients in my clinic. We have have some staff at 9 News that got both COVID and flu together.
Oh.
Yes, because they travel together. They're both respiratory viruses, and they're both rampant right now. We've got a COVID surge, we've got a flu surge, we've got a norovirus surge. Remember that? That's the one that gives you the GI illness.
Yep, had that one too.
And an RSV surge in the South. So we're really in a period where it needs to be, you need to go back to the hand washing. If you don't want to wear the masks, at least make sure you're not touching your face a million times a day, and make sure that if somebody is sick, you test them
say that,
early.
and it's funny because the second you
Your
say
face
that, my
gets a
face
little
itches.
itchy.
I know. You're like, no, don't do it. Don't do it. Also, one other thing, too, because we got all these circulating right now, and it's so dry here in Colorado, like that RSV and stuff, that's a huge one, too.
It's huge. And, you know, the HHS has just actually changed the vaccination schedule for kids to not suggest RSV as a mandatory vaccine. So I don't know how that's going to change the landscape. But the more infections we have, the more these viruses get an opportunity to mutate, and the more that they start outsmarting our vaccines and our immune systems. So it seems like we really have to try to keep infections at bay, not just, of course, to keep ourselves in work and in school, but also just to prevent the virus from having the opportunity to start to outsmart us.
And if you are feeling sick, stay home.
Please.
Like I mean, it was the worst time of the year for me to get it, but I was like, no, I'm not going in until my fever's gone for over 24 hours. Same thing you would do with a kid in school.
I'm so glad you did that. I had somebody who came to the office the other day while they had COVID. And then literally our whole office, you know, had
You're
to
like, you're not looking like a hero right now. If anything, you're the villain because you're bringing it to all of us, and we don't need that.
Yeah.
Cookies, that kind of stuff, donuts, those are fine, but no, not on the flu. So just make sure to protect yourself if you can. Get the vaccine, and like the importance of hand washing and everything. I know we've talked about that on the show before.
Yeah.
But just make sure you're doing what you can to keep yourself and everyone around you.
And I would say get that sleep. You know, that 7 to 9 hours of sleep, it's really, really important for our immune system because it really does keep our immune system in shape.
All right. Well, thank you, Dr. Kohli. Check her out at Cherry Creek Health. Just make sure you don't go in with a fever.